Hi guys, this is Medicine Jerk and today's our topic is atherosclerosis. Okay, atherosclerosis. And basically atherosclerosis is off pathotopic, but in the broad sense we should integrate the atherosclerosis in between the general medicine and also within the pathology so that we can get some good knowledge about the pathology of various types of diseases. So first of all, we should see the etiology. Within the etiology, there will be actually damage to the blood vessels. What part of the blood vessels? That is endothelium. Okay, there will be damage to the endothelium. So what are the factors which are involved in the damage of the endothelium? There are mainly 5 factors. First factor is hyperlipidemia. Okay, first factor is the hyperlipidemia, and the second factor is smoking. Second factor is smoking, while the third factor is diabetes mellitus. Fourth factor is old age or the geriatric age, and the fifth factor is genetics. That means hereditary type of condition may be present in these patients. Okay. So all over the world, actually atherosclerosis is understood based on the hypothesis, and all over the world there is one hypothesis which is very popularly adapted. Okay, na? So the whole pathogenesis is based upon those on that hypothesis, and that hypothesis is nothing but response to injury hypothesis. That hypothesis is response to injury hypothesis. Okay, so you know that within the blood vessels there are actually 3 layers. Okay, within the blood vessel there are 3 layers. From the outside to inner side, it will be tunica adventitia, tunica media, and the tunica intima. Okay, and the layer which is extra present above the tunica intima is nothing but endothelium. For suppose this endothelium is damaged over here. Okay, because of some factors. Because of some factors, here the endothelium is damaged. So what happens when the endothelium damaged? See, let's see. Okay, now the endothelium is here damaged. So within the blood vessels, there are a lot of LDLs will be present. All these LDLs will get oxidized. Okay, to form LDLO. Okay, to form the LDLO. These LDLO are very dangerous because these are the free radicals. Okay, and these free radicals will furtherly damage the already damaged endothelium. Okay, these free radicals furtherly damage the already damaged endothelium. So the body thinks, oh my god, I have to stop these free radicals or the LDLO. Then suddenly the immune system will be activated. Okay, and the macrophages and the monocytes, that means monocytes and macrophages will come into play. Monocytes and the macrophages know only one thing: they can kill the whatever thing comes in between in their path by just engulfing them. Okay, so here the LDLO will be engulfed. Okay, LDLO will be engulfed, and the lipid, and this is nothing but the lipid laden macrophages or the lipid laden monocytes. Okay, and these lipid laden macrophages are also called as foam cells. Okay, and these foam cells will activate the plasma derived growth factor. Okay, plasma derived growth factor and transforming growth factor beta. Okay, these two will activate. These two will be activated. On activation of these two factors, there will be recruitment of extracellular matrix. There will be recruitment of extracellular matrix. What is meant by extracellular matrix? One is the smooth muscle cells and collagen. Okay, it's a composition of the smooth muscle cells plus collagen. So, okay, smooth muscle cells and collagen. Now, these smooth muscle cells and collagen will surround the foam cells. Okay, will surround the foam cells, and the smooth muscle cells, collagen, and the foam cells together called as Fibro Atheroma. These 3 things are together called as Fibro Atheroma. Okay, Fibro Atheroma. Okay, now we just will recap once again diagrammatically. So let's see. See here here the endothelium is damaged, so the LDLs will be oxidized. So these LDLs are oxidized, and these oxidized LDLs are engulfed by the macrophages. So those macrophages are nothing but the foam cells. Okay, and these foam cells will activate plasma derived growth factors and TGF beta, which recruits the smooth muscle cells and also collagen. Okay, smooth muscle cells and collagen. Together all these things, okay, together all these things is called as Fibro Atheroma. So all these things are togetherly called as Fibro Atheroma. So a lot of questions ask what is the location. Okay, na? Fibro Atheroma is formed between the two layers, and those two layers are tunica intima and tunica media. Tunica intima and tunica media. Okay, so this is just a transverse section. We have taken off the blood vessels. Now we will see in the cross section. In the cross section, how it will be appeared. Okay, so if we'll take the cross section, we can see this type of some in this way. Okay, so the center will be occupied by the central part of this central part of this atheroma's block is occupied by necrotic core. Okay, and this necrotic core is surrounded by foam cells. Again, these foam cells are surrounded by smooth muscle cells and collagen. Okay, smooth muscle cells and collagen. These are smooth muscle cells. These are smooth muscle cells. And these are, so this is necrotic core. Okay, necrotic core. This is the necrotic core, and these are the foam cells. Okay, these are foam cells, and this is nothing but the block. Okay, block is of two types. Everybody knows that. Okay, we'll discuss it later. So together, all these things are togetherly called as Fibro Atheroma. So one more important question that is frequently asked in the examinations is key: what happens in advanced Fibro Atheroma? There is one change in the advanced Fibro Atheroma, that is the smooth muscles which are present within the Fibro Atheroma will undergo apoptosis. Okay, will undergo the apoptosis. So now we'll see some of the complications of this atheromatous block. Okay, so what are the complications? Okay, complications of this Fibro Atheroma are the atheromatous block. So let's see. First one. Now you can see the block over, we can see the block. Now thickened part is nothing but this calcified part. If this block, what happens if any type if the block ruptures or the block damages, again there will be new formation. There will be formation of a new thrombus over there. Okay, na? This is one of the complications. Or the ruptured block. Okay, the ruptured block may also cause embolism. Okay, na? Embolism, which is mainly because of necrotic core. Okay, na? Necrotic core. And next one, it will also permanently damage the blood vessel, which leads to the abnormal dilatation of the blood vessel. So that is nothing but the aneurysm. Okay, that is aneurysm. And one more complication is dissection of that concerned blood vessel. Okay, na? There will be dissection of the blood vessel within the tunica intima and tunica media. Okay, so this is atherosclerosis.